Good afternoon, and thank you for joining us today for this community briefing on COVID-19 and our local response efforts. Joining me again is interpreter Margie Propp. Thank you so much, Margie, for your services. We will have our regular update on our city's response to COVID-19 in just a moment, but I wanted to start today by addressing the tragic and senseless death of George Floyd in Minneapolis this week, which has provoked anger, sadness, and grief in so many of us. First, I want to extend our community's condolences to George Floyd's loved ones and to all of those who have been impacted by the stain of violence that continues to be perpetrated against African Americans in our country. Not only do these tragedies harm the family and loved ones of those who are lost, but they weaken the very fabric of our entire society. The police officer in Minneapolis who killed George Floyd was charged today with third-degree murder and manslaughter. Justice must be served in our nation. And we all must continue to address and rectify systemic racism in our society whenever and wherever we find it. Secondly, the First Amendment guarantees the sacred right to let our voices be heard. There is so much to grieve right now and much that needs to be said and expressed. And I commend those who are exercising their constitutional right to speak out against hatred and violence. Today, I saw peaceful protesters at the Capitol doing just that. And each of them was wearing a face mask. And I want to thank them for expressing their concerns in a way that protected themselves and others. To anyone else who's planning to step out and speak out in the coming hours or days, I ask that you follow their example and do so safely in light of the pandemic that we are still fighting. And now for our community update on COVID-19 and how we can all protect ourselves, our loved ones, and our community. Starting next week, we will be conducting these regularly scheduled televised briefings twice a week, on Tuesdays and on Fridays. Our efforts to stop the spread of COVID-19 remain our top priority, and our commitment to good hand washing, wearing face masks, and physical distancing remains as strong as ever, and we would ask that your commitment to these proven public health strategies remains undeterred as well. As we continue to adjust to life with this virus, we here at City Hall also must continue the regular business of our city. We will continue to provide the media with daily written updates, and the latest information and an updated dashboard will continue to be posted at covid19.lincoln.ne.gov. And if our community's situation changes, and if we feel the need for this kind of direct communication that these briefings provide, we will add televised briefings as needed. Here in Lincoln today, we have had an additional 23 individuals test positive for COVID-19. The total number of lab-confirmed cases in Lincoln now stands at 1,158. Our total recoveries identified to date is up from 158 to 163 individuals. Lincoln had few cases reported before the end of April, so we do anticipate that additional recoveries will be reported in the coming weeks. More detailed demographic information from our case investigations can be found on our website, where you will also find our COVID-19 risk dial. That's the tool that has been in place for about 3 weeks now, which helps our community know what actions and behaviors we can take to protect ourselves and our community. The COVID risk dial provides a visual color-coded depiction of local conditions here in Lincoln and Lancaster County. In essence, it provides a forecast of risk of the spread of COVID-19. Red, of course, represents the highest risk of COVID-19 spread, and green, the lowest. For each color of risk, our public health team provides specific recommendations for individuals and businesses about how to safely navigate our community or operate their businesses in light of local health conditions. All of these recommendations have been informed by guidance from national resources, including those produced by Johns Hopkins University, the CDC, and the White House Coronavirus Task Force. We update the dial each Friday based on local data to estimate how high the risk of spread of COVID-19 is in our community. And here to share more on the health department's update to the dial this week, as well as on the latest case investigations, is our health director, Pat Lopez.
Thank you, Mayor. At this time, the risk of spread of COVID-19 in our community remains high, so the COVID dial will stay in the lower level of orange. This is unchanged from last week. The health department continues to use local and regional data from the previous 2 weeks to determine the direction we are moving and how high the risk of spread of COVID-19 is in our community. Here is an update of the main factors. First, we look at testing capacity, and we have determined that this indicator is stable. We have arranged over 3,000 tests that have been completed each week for the past 2 weeks. This has been accomplished mostly through testing at hospital drive-through sites and a few mobile testing sites. Yesterday, Bryan Health and CHI St. Elizabeth completed 415 tests at the hospitals and their drive-through testing sites. In addition, Test Nebraska has completed over 4,000 tests in Lincoln since May 8th. This week, we did see a decline in testing due to the holiday weekend. With Test Nebraska moving to another Nebraska site this week, we do anticipate a leveling off or decrease in the number of tests being completed. Test Nebraska will return to Lincoln June 8th and 9th. The important point is that we do still have testing capacity, and we strongly encourage people to sign up to get tested if you have symptoms of COVID-19. To get started, you can contact your physician or fill out a risk assessment at chihealth.com or bryanhealth.com. If you need assistance, you can contact the health department at 402-441-8006. This afternoon, we conducted our second drive-through testing site event at Lincoln High in connection with the cultural centers. Over 60 people were screened in a 2-hour period. And we'll have more information at our next briefing. A second factor is the number of positive cases. We have seen a small improvement to this indicator. Again, that number varies depending on delays in receiving electronic information reports from the lab. So we look at the average number of cases reported daily over 2 weeks. The number has remained fairly flat at about 30 new cases per day. Omaha is seeing increasing numbers at this time, so we are carefully watching that situation and monitoring our local case numbers to watch for any potential surge. A third indicator is the overall positivity rate, and here too we have seen some improvement in Lancaster County. This is the percentage of all tests completed that are positive. The total number of positive cases in Lancaster County is 1,158. And the total number of tests completed in the county is 15,208. That gives us an overall positivity rate of 7.6%, down from yesterday's rate of 7.8%. The rate on May 18th, about 2 weeks ago, was 8.4%. In comparison, the overall rate for the state remains at 13.9%, and the national rate is 14.3%. Our hospital capacity is another important factor, and here too we are holding steady. In the early days of the pandemic in Lincoln, our residents did an outstanding job of following our health recommendations. As a result, we were able to avoid a surge that could have stressed our local hospital system. Over the past 2 weeks, we have seen a leveling off in the number of COVID-19 patients in our local hospitals. This week, we have averaged 38 COVID-19 patients hospitalized and 11 using ventilators. The number of COVID-19 patients in our hospitals is down from 35 yesterday to 34 today. 22 of those individuals are from Lancaster County, and 12 are from outside the county. The number of patients on ventilators remains at 12 today, 8 of them from Lancaster County and 4 from outside the county. The final indicator is the capacity of our health department to conduct contact tracing. And at this time, we have been able to keep up with the demand. Contact tracing is crucial to our efforts to minimize potential clusters and outbreaks in the community. Over the past 2 weeks, we have added another 7 staff members, so we now have 34 individuals available to do contact tracing. As we reported yesterday, our investigations have identified additional connections to the outbreak in Saline County and smaller clusters here in Lincoln. The number of Lancaster County residents who are positive cases related to Smithfield and Crete remains at 319. The numbers at our Lancaster County locations are unchanged. The number of cases at Smithfield here in Lincoln is 27, and the number of cases at Smart Chicken in Waverly is also 27. The additional local cluster location we identified yesterday is Universal Cold Storage, which has 2 locations in Lincoln. Both locations reported cases, and the total number of cases connected to them is 31. To summarize, our COVID-19 risk dial remains at orange level. The risk of COVID-19 spread in our community remains high. And as restrictions ease on June 1st, we need our residents to remember that they are at risk of contacting the virus at any time they are out in the community and around others.
With the risk of COVID-19 in our community remaining high, this is definitely not the time to let down our guard. We must remember to take precautions. We want you to try to stay 6 feet away from others, keeping that physical distance. Continue to wash your hands frequently and disinfect highly touched surfaces. Be a hero. Wear a face mask when you're around others outside your household. And those who are age 65 and older and those with underlying health conditions should continue to rely on help with needs that are outside the home. Any one of us can be an asymptomatic carrier of the virus and unknowingly spread the disease. Please remember that the actions that you take could have significant consequences and could impact our entire community. Take the steps to protect yourself and to protect others. As we close this week's briefing, we honor the generosity of our community. Yesterday's Give to Lincoln Day campaign yielded record-setting results. The people of this city donated $6.6 million to help about 450 local nonprofits. That shattered last year's record of $5.5 million. Another record high was the number of individual donors. 28,000 people donated to help the agencies that help the people in our community. That means many new donors saw the needs in our community and decided to help. And during this pandemic, many nonprofits have seen the need for their services grow. One of those is the Food Bank of Lincoln. And because of Give to Lincoln Day, that agency alone now has an additional $398,000 to feed the hungry. In addition to that, the Lincoln COVID-19 Response Fund raised almost $70,000 from 717 donors. We want to thank the Lincoln Community Foundation and all those organizations that contributed to the match dollars, and each and every one of the 28,000 donors who took to heart what has become the motto of this pandemic. We truly are all in this together. And with that, I would open it up for questions.
Mayor, this is Bill with 1011.
Hi, Bill.
I noticed on your Lancaster County dashboard that the number of deaths has gone from 9 to 7. And I was curious as to why.
That must be a mistake, Bill. I have Diane pulling it up right now. It shows 9 here. Sorry, I can't explain that. We see 9 on our dashboard.
It has changed. It was down to 7 at the start of the meeting, but it's back up. So thank you.
Sorry about that.
That's okay.
Mayor or Director Lopez Riley at the Journal-Star. First question, the health department recommended that the Lancaster Event Center not hold the National High School Rodeo Finals in July. And I guess I'm just curious if either Director Lopez or yourself could explain some of that recommendation and the concerns that were raised about that gathering.
I'll Just add up front that when the plan was submitted to the health department for review here in Lincoln, Lancaster County, one of the first things that was determined was that the idea that they might be able to limit it to 3,000 people as in accordance with the state directed health measure and the local health measure that aligns with that of the state was not something that the plan could meet. But to give you more information, more details on that plan, I'll let Director Lopez come forward.
Good afternoon, Riley. Just to kind of summarize, our decision was based on part on the risk of spread of COVID-19 that would be posed to the people in our community and county that would result by bringing thousands of people from dozens of states and potentially several countries together. In addition, the large number of people expected to attend, the close proximity of these individuals that they would be in for the length of time that they would be at the event center, and some of the factors causing serious concern to us. Because this event has the potential to overwhelm the health resources of the community, not allowing the event to take place is necessary to control the spread of COVID-19 in Lincoln and Lancaster County.
When, Pat, was that decision made?
We notified them last evening, Riley.
When you consider an event like that and the plans they had in place, I mean, how plausible is it that an event like a football game could be held at Memorial Stadium a month later?
It's really hard for me to answer that without having really looked at or received any information from the university about their plans. So it's really on an individual basis that we look at each event and how they're able to adapt and provide physical distancing and safety for the individuals attending.
And a process question, with those larger event sort of plans that are being submitted, how soon before the scheduled event does the health department need to be notified of said event?
I appreciate that question, Riley. It would be wonderful if events are being planned that we be notified as soon as possible because that allows us time to review the plan. And if there can be some adjustments made that would allow the event to be successful, the sooner we know that and we can have that dialogue, the better.
I'll follow up with that. Pat, was there any dialogue back and forth about adjustments that might be able to be made by the event center and rodeo staff, or was it simply not plausible?
Really, after we reviewed everything, Bill, and we've been in contact with the event center, we worked with them on several occasions, but when you look at the sheer magnitude and the number that would be attending the event and the risk it poses to our community, that really wasn't plausible in this situation.
Am I getting the impression from you, Pat, that it was more all of the people that would be coming from across the country was more of a concern than the spatial distancing that would take place between people?
No, it was really all of those elements combined together, Bill. It wasn't just one thing, but we have to think about if you have all those people coming from various parts of the country, and I think we all see what's happening in the forecast that's bringing all these individuals into the community who are going to be in close proximity to each other, and not only that, will be out in the community as well. So it wasn't just one thing, because had that been the case, we could have looked at things differently.
We certainly are disappointed about the rodeo not being able to take place. We were excited about the event and partnered with the event center to make street improvements to accommodate the increased traffic they anticipated, but I support the decision of our health director by not allowing this event to take place, that it's necessary to control the spread of COVID-19 and to really align with some of the numbers that we've seen in both the state and local directed health measures. It appeared from the plan that this might bring as many as 7,000 to 10,000 people, which is more than double sort of what the limits are for gatherings at this time. Any other
Mayor,
questions?
I'll ask you directly. With that news, are you thinking that there will be football at Memorial Stadium this fall?
I haven't had that conversation with the university. Everyone remains hopeful. We certainly see the direct relationship between the success of the university and the success of our city. And what we have to, of course, keep in mind is that the health of our students, the health of our athletes, and the health of our community, and all of those are important to our economic recovery. We can't disaggregate them. We need both. So we'll do everything we can to be thoughtful in considering how to move forward and to work with the university. But I think that's a big question mark for colleges and university towns across the country right now.
Mayor, is there ongoing dialogue between you and President Carter or Athletic Director Moose at this point, or have those conversations not yet started?
I do speak frequently with President Carter. We haven't broached the topic of football recently, but I very much value the opportunity to think through the issues related to the pandemic with him, as he's another, leader of a large system that's right here in our community. So I very much appreciate the conversations and dialogue that we've had.
Unrelated question for Director Lopez. With the latest number of cases, has the new reported case trend appeared to level off, or are you able to make any sort of, are we at the top of our peak?
Well, we are kind of staying flat right now. But we're still monitoring that closely and watching some of these outbreak situations. And as I mentioned, we're watching closely what's happening in Omaha as well and what kind of impact that would be here. But for this week, our number of tests our number of positive cases are down this week from last week. So we'll just continue to go from there. It's hard to predict right now at the stage we're at with the COVID, but we're definitely right now able to do the contact tracing, and we're able to mitigate the spread and do the education needed.
Are there any other questions? Well, if not, I would just remind you that we're going to 2 briefings per week. Starting next week, we'll be back on Tuesday at 3:30. And we're so appreciative of your time and attention as we all try to navigate this pandemic safely and stay healthy and connected and together through this challenging time. We'll see you next week.